The relationship between airway, posture, and jaw development. Forward head posture characteristics. Ears positioned in front of the shoulders. The forehead is sloping further backward. More of a pronounced nose that may be crooked. Flatter cheeks. Wider angle between the lower part of the nose and the top lip. Thinner lips. Wider angle between the lower part of the jaw and the front part of the neck. Less of a cervical spine curvature. Backward pressure on lower jaw resulting in forward bent condyle. Hyoid bone sits lower and forward. This forward head posture allows for an open airway. Correcting the posture will allow for the head to derotate. The tongue goes back with the lower jaw, restricting the airway. The spine curve improves and the ear position is balanced over the shoulders, allowing for less neck muscle strain. With the back movement of the tongue, the hyoid bone also gets pushed out of the way downward, creating a more double chin effect. This position is unsustainable, and the chin lifts forward and up to open the airway, like in mouth-to-mouth resuscitation. The process of developing upper jaws with the use of an anterior guided growth appliance. Pre-treatment jaw requiring development include narrow dental arches, narrow and high roof of the mouth or palate, underdeveloped upper jaw or maxilla. Narrow and high palatal arches may be linked to restricted nasal passages. The fixed appliance is fitted with a pad placing pressure on the spot of the roof of the mouth. The other wires are used to keep the appliance in place, as well as allowing for the force to be exerted on the spot adjacent to the nasopalatine canal. A spring is compressed against a metal tube that allows for the wire in the tube to move slowly forward and transfer the pressure to the pad on the spot. The front segment of the upper jaw moves forward and is postulated that new jaw growth results. When the required forward growth has been achieved, the appliance is moved and the next stage of controlled arches, braces, begins. A rigid wire called the Fixed Removable Lingual Arch, or FRLA, is placed in the roof of the mouth attached to the molar teeth. This wire is pre-adjusted to allow for the right width of the palate, as well as to have an effect on possible canting of the teeth. A light force wire is placed on the outside of the teeth, attached to the orthodontic brackets. Both these wires have the effect of developing the arch. In order to develop the arch, stop locks are placed on the light wire to allow for the wire to be bumped outward and locked into place. This keeps the wire from sliding into the tube on the molar teeth and have a net outward pressure to the outer wire. However, for every force there is an opposite and equal. The stop lock will also have an effect on the molars to push these back. The tongue needs to be on the FRLA to anchor the molars in place. To illustrate this principle, imagine two men in a cart with the aim of reaching the end point forward. The man in the front cart uses a stick to push his cart forward, but the back cart would also move back at the same time, resulting in not achieving the desired outcome. With the back cart using an anchoring mechanism, keeping it from moving back, the desired effect could not be achieved. This is to illustrate the equal but opposite effect and applies to the wire that is on the outside of the teeth as well. With the application of power chain, elastic bands, the teeth will be pulled forward, but there will also be a resultant backward force. Without the use of stop locks and the FRLA, loss of arch development would result. This would then result in back teeth moving forward, but also the front teeth moving back and meet somewhere in the middle and is undesirable. As forward movement on the teeth is achieved, there is also an outward movement as the light wire would like to have a wider shape. This results in a wider dental arch. When the premolar teeth are pulled into their forward position, the stop locks are placed just behind these premolar teeth. The idea behind this is in order to move the molar teeth into their rightful place, the FRLA must be removed. It is undesirable to lose the forward jaw development achievement so far, and to limit Newton's third law, some kind of anchor on the front teeth need to apply. The stop lock serves to tie the front teeth into something resembling the sticks principle. It is easy to bend one stick, but bending a few sticks together is much harder. This allows for a wider, more forward developed arch with a potential shallower palate. It has been shown that a wider, shallower palate has a beneficial effect on the patency of the nasal passage. Changing the upper jaw position can influence the airway. Moving the top jaw forward with a forward Dental Orthopaedics appliance in a gradual way and placing pads on the bite surfaces of the lower back teeth results in a few changes. The condyle of the jaw joints move forward and down as the lower jaw is moved gradually forward in sequence with the top jaw. This allows for a more forward tongue position away from the airway and in turn for the gradual derotation of the head with a better spinal alignment. Posture improves. Forehead is less sloped. Nose is less crooked. Condyles remodel and straighten to some degree to allow improved jaw joint movement. The mandible bone shape gradually remodels. As the tongue comes forward, the hyoid comes forward and up. Better airway and better posture. Cheeks and lips are a little fuller. Angle between the neck and the chin improves. A lessening of blue dark circles under the eyes.